When you think about osteoarthritis, you think about a joint that has been worn down. Uh, but the mental picture that gives you is not entirely correct because it's not fully worn down. There's more of a problem because it's rusted. So if you eliminate the rust, you can get rid of most of the pain and most of the symptoms of osteoarthritis. So you shouldn't be afraid to bend or flex the knee because the more you flex it, the more you bend it, the better it becomes. Now, the problem is when you bend it, it hurts. And so most people avoid bending it. And this actually makes it worse because now you're not moving it and it gets into a vicious cycle. The less you bend it, the more it hurts. The more it hurts, the less you bend it. So finally, the knee becomes stiff and fixed. So what you need to do is exercises that'll help you bend the knee properly. Now, but you've got to find ways to bend it without hurting it. So that's the basic idea. So this is an exercise that will help you do that. So you might have seen a video on this channel about the front foot elevated lunge. It was a short video. It wasn't very descriptive, but that is painful for people who already have osteoarthritis. So this is an intermediate step. So what I'm asking you to do is get a chair. It'll be good if it's a little heavy, and it should be on a non-slippery surface. So you'll hear me complaining about chairs all the time, but in this case, I'm actually using a chair to help my exercise. Now, if you lack balance, you grab the backrest of the chair, put your foot on the seat. Now, let go of this. Put your hands on the seat, inside your feet, not on this side. I want it here. I want both of your hands here. And now I want you to bend the knee as far forward as possible without pain. Now, this is important. You're not supposed to cause pain. Now, you do that, get to the point where the pain starts, and then come back. Now, coming back, it's not enough if you come back to this position. I want you to stretch out as far as possible without letting go of your fingers, without letting go of your toes, and then back again. So I want you to do this 20 times on one side and 20 times on the other. So when you're bringing the knee forward, I want the shin and the knee to rub against the backrest of this chair as you move forward. Now, make sure that your body stays square. I don't want it rotating this way to make things easy for you. I want the hip and the foot to do the mobility. I don't want this. So this is what you do. And as you get lower, in order to help you to get lower, you can bend the back knee. Now, since most of the load is on the hands, you should be able to go further forward with your knee than you would if you were just doing that. So this is the transition part. You're going to use the hands to help you get your knee bent as far as possible. Now, the further you go, your heel can come up. That's okay. And you do this 20 times on one side, stretch it out fully as far as you can go, come back again, and you repeat this 20 times on one side, and then you go to the other side and do the same for the other leg. Now, because that's not easy for me, because it's the cameraman's there, camera woman is there. So now this knee goes in front, and you do the same on the other side. Make sure that your palms are flat on the seat of the chair. Don't come up on your fingers because that's not stable and you're going to end up with other injuries. And this is what you do 20 times on one side, 20 times on the other, thrice a day, and get your knee flexible. Once your knee is more and more flexible, you'll be able to start putting more and more load on it, and it's going to get stronger, and you might be able to keep the osteoarthritis at bay. So that was today's video. Let me know what you think about it in the comments. Thank you.